Welcome to You Can't Handle the Truth, where we dive into the real, raw truths about health, wellness, and self-growth. I am your Real Talk guru and your rebel healer, here to cut through the noise and dig deep into mental, physical, and spiritual health, uncovering the truths many aren't ready to confront. But we're going to do that together. My name is Natalie, and I am going to get right into this because this is about menopause. Again, I have talked about HRT on this channel multiple times, and I decided to podcast about this today because I found, as you can see, I found this subreddit where another woman just like us, right, going through menopause, is asking about this. And here's what she says. She says, I just learned from TikTok and the internet, then ARN, that natural born women lose their Labia Minora through menopause. Say what? She says, I am not a doctor or a nurse, anything like that, but I am a menopausal woman who was clearly not taught enough about my body. Geesh. Does American Girl make a body book for Nana? Let me know. You know, exactly. It's like we don't come with a manual. Like, we just do not come with a manual. Nobody tells us what to expect. And if you go back and look through my videos on this channel, you will find that I've done multiple videos on menopause. I am 55. If you are ages 35 to 60, you need to know about this because these are changes that are happening with your body that cause discomfort. They cause changes in your libido. And it's really interesting to me that every other commercial on TV is about some blue pill, right? We all know what the blue pill is, right? It's for him. It's for the guy that's losing his libido. So if it's openly discussed, the libido of our counterpart, right, of the male, why not discuss the libido of the female? And the truth of the matter is that you don't lose your labia, but it actually atrophies. And we're going to go through, I actually pulled some information on this, and I'm just going to go through it with you. We're going to go through it together because I was absolutely shocked about this because I'm a registered nurse and I didn't know. I've been to a gynecologist. Drop me a comment down below. Let me know how many of you have been to the gynae and nobody has talked to you about this. How many have told you, like, you know what? No, we don't think you need to have hormone replacement therapy. Now, about a year and a half ago, I opted for hormone replacement therapy because my hot flashes were so out of control. I wanted to cry. I could not go anywhere or do anything without sweating profusely when everybody else is sitting and they're just kind of relaxed. And if you have hot flashes, if that's one of your symptoms as you go through perimenopause and menopause, you know what I mean. It's very uncomfortable. This is why, a lot of times you'll see my hair is pulled back because if I wear my hair out, I would have to deal with those symptoms, which I don't have very much anymore. But when I did, let me tell you, and there were triggers, right? Glass of wine, trigger, alcohol, trigger. So anyhow, let's get into this. Drop me a comment if you knew about this and I decided to bring this to You Can't Handle the Truth because why is this a truth that we're not being told? That's not being shared with us. Ironically, we didn't hear from it from our moms, our grandmothers, our aunties, nobody. Our friend, we just don't talk about it. What, are we embarrassed? Are we ashamed that we have decreased libido and we have changes that happen to our sexual organs? Men have it too, but it's more openly discussed for them and they commercialize it like it's a great thing, right? Because they show you in the commercial, they show you the woman and she's like, yeah, I got the blue pill for my man. Well, what's the man getting for you? I'm just saying. Anyway, so they need to have a commercial like that. I got my wife or I got my girl some estrogen, right? Why not? Why not? So anyhow, I'm going to go on with this. So For those who don't know, this is labia minora. This is the inner fold of skin around the vaginal opening, located just inside the labia majora, the outer lip of the vaginal opening. This is like a thin, sensitive tissue, but it plays an important role in protecting your vaginal and urethral openings. Yes, your urinary tract. Did you know that? Did you know that was part of the function? And not just that. The other function is it contributes to sexual sensation. So when you're having sex, it feels good. So if any of you are having decreased sensation down there, or you're having decreased pleasure during sexual intercourse, this could be why. Somebody drop me a comment down below. Drop me a teary-eyed face, like, because we don't know. We didn't know this, right? So anyway, why is this happening? Why does this happen during menopause? Well, it happens because we have a decline in estrogen, plain and simple. If you go through all of my other videos that I have on here and all of the other symptoms that can occur with menopause, and I didn't even post all of them because obviously I didn't know this was one of them until recently, until today. So, and I thought I need to talk about this because anytime I get a chance to talk about menopause, anything that can help a woman going through menopause understand what's happening with her body, I am here for it. So anyway, estrogen is a key hormone that helps maintain the elasticity, thickness, and hydration of vaginal and vulvar tissues. Yes, yes, yes. When estrogen levels drop, the following changes can occur in the labia minora: thinning of the tissue, the skin and mucosal layer of the labia minora can become thinner, making them more fragile and prone to irritation or tearing. And this can happen during sex, which can make sex more uncomfortable. And if anyone has had this happen or is having this happen now, maybe now you understand why. Right? Loss of elasticity. The labia minora may lose some of the suppleness and become less flexible or even shrink in size. Right? So as it's shrinking, guess what? You're getting less protection to the urethral opening. Hold on to that thought for a minute. Next is decreased blood flow. Reduced estrogen levels can lead to decreased blood flow to the vulvar area, which can impact the color of or the overall appearance of the labia minora. And with decreased blood flow, decreased sensation, right? Dryness. Without adequate estrogen, the tissue may lose moisture, contributing to dryness and discomfort, tearing, and all of that. So this is, and there's actually a name for this. The process is a broader condition known as genitourinary syndrome of menopause, GSM, which affects the vulva, vagina, and urinary tract. Who knew? I didn't know. If you knew, drop me a comment and say, yes, you knew. What can a menopausal woman expect? Changes in appearance. The labia may appear smaller, lighter, or in color or less pronounced. Increased sensitivity. The thinning tissue may become more sensitive to irritation from clothing, sexual activity, or personal care products. Exactly. You don't want to use like harsh soaps. You want to make sure you're well lubricated for sexual activity. Even then, you can still experience some discomfort or pain. Women may experience itching, burning, or pain, especially during intercourse or when wearing tight-fitting clothing. Yeah. Increase vulnerability to infection. Thinner, drier tissues are more prone to micro tears, which can increase the risk of infections like urinary tract infections or vaginal infections like yeast infections. Yeah. So because the labia already is the tissue's tearing, so it opens up the area to infection, so you can get a vaginal yeast infection. And since the protective labia minora is shrinking, you now don't have the protection around the urinary tract, so some of that can get into the bacteria, can get into the urinary tract and cause infections. And you know, women wonder why are older women always having your UTIs? Well, hello, this is why. This is why they're having UTIs. Now, what can you do about it, right? topical estrogen. Prescription estrogen creams or vaginal tablets can help restore tissue thickness, elasticity, and hydration in the vulvar and vaginal areas. Moisturizers and lubricants, regular use of vulvar moisturizers, non-hormonal, just regular like KY jelly can alleviate dryness, water-based, like because it's water-based and silicone-based, can reduce discomfort during sexual activity and reduce the chance of that the tearing, right? Because that tearing is where it becomes painful. Hormonal replacement therapy, HRTs. I personally have opted for pellet therapy, which I started a year ago. I'm due to go back. I've been due to go back and I haven't, but I actually got such relief that I just didn't go back. But now I'm noticing some symptoms are coming back, so I'm gonna go and get another dose of the pellet therapy, which can be more expensive. But if you can't do that, even the vaginal, cream that you can put on. And I'm going to show you, I found something online. I don't know anything about this. Talk to your doctor. I am not prescribing you anything. And, there are some controversies around using hormone replacement therapy if you have breast cancer. I've done the research myself and there's contradicting studies. So you want to follow up with your doctor, but like some women have such severe symptoms that they're willing to take the risk. And I think it's a personal choice, honestly. If you're sexually active and you're constantly having like skin tears down there and that's causing UTIs and yeast infections, then, are you going to want to have sex? Like it's not comfortable. You're going to shy away from it. And especially if already like you're kind of losing sensation, right? Like, so it's not even feeling the same because the labia has shrunk and lost blood flow. It's for the same reason guys take the blue pill. Guys take the blue pill to increase blood flow to the area to give them the erection that they need. And by the way, I should have said this at the beginning. This is not for children. So if you have any children in the room, like they should be out. I will put a warning at the beginning of this because, although this is a medical discussion, but you may not want your children hearing this. And the next thing that I want to say is that share this with your daughters. Share this. And if you're guys out there and you're listening to this, share this with your wives. And, I'm glad that you're listening because now you may understand her discomfort. What's going on with her? Why is she not engaged as much into the sexual activity? Well, the sensation has decreased, which can be the same as the guy. It's like the guy not being able to get an erection. It's so discussed on TV. Like it's a thing. Like so let's not be ashamed to discuss what's happening with us ladies. And so it's a manageable part of menopause. You want to discuss them with your provider. And I've seen many in the subreddits that I belong to that many women will say they go to their doctor and their doctor is not open. They won't even listen to them about hormone replacement therapy. Well, find another doctor. Get a second opinion. I'm not telling you to get it or not get it, but if it's something that you're really wanting to try and something that can help you, then why not? And I actually was doing some research and I looked online. This is online. Estrogen boost, right? This is for women ages 40 to 60. This is for a topical hormonal estrogen therapy, right? And it helps with all these things: mood swings, anxiety, muscle loss, brain fog, weight and body changes, right? And I want you to talk to your doctor. I don't want you to go randomly, and ordering this stuff. It's called estrogen, the estrogen boost, and I guess they have doctors online that are willing to take your call and maybe do a phone call with you. I have not used them. Of course, they have pictures. These places always do. And I'm not telling you to do this, but I'm showing you how inexpensive. Where was it? I saw the price somewhere listed. Hot flashes and night sweats have improved tremendously. I've lost 5 pounds, which is great. Have been sleeping better. I love this product. My joints, especially rotator cuff, shoulder pain from loss of estrogen has made my life better. Like so many women have used estrogen. You can take internal estrogen, you can take pills, you can do the pellet. I use the pellet because it was more natural, but if there are risks, then the risks are still there. So you want to discuss. And I mean, this place seems to have a doctor. And what I want to say, treat symptom of menopause for $44 a month. You know? So for $44 a month, you can improve so many things going on in your life. But you do need a consultation. You do need a doctor. I don't have any affiliation with them. I was just doing some research and this came up. But I wanted to show you how simple it is and how you can get yourself some treatment to make yourself feel better, to at least attempt to feel better. It may or may not work. I don't know. It may not work for everyone. You just want to understand the risk. I think the consultation is like $40. Oh, here it is. Online visit, $20. Solution, and then to get this, it's $44 a month. I don't know. I mean, expert providers, board certified dermatologists, and this is for they say they use it on this is for the skin. And I'm not telling you to use this company. I don't know who this company is. I have no idea. But I'm just telling you that it can be life-changing to understand what's happening with your body and then get some treatment. Get some treatment for it. Use some hormone replacement therapy. I know it made a heck of a difference for me. I couldn't leave my house. I was embarrassed to go anywhere or stop and talk to anyone for fear of just all of a sudden just breaking out in a sweat. So let me know what you think about this topic. I just thought this is one of those truths that are out there that we need to be aware of. Why are we not sharing this? Share this with your daughter. Share this. If you're men out there listening, like I said, share this with your wives, your girlfriends, whoever, your daughters. Let them know. Let them know that it's okay, that they're not imagining things, because this is, and I specifically came with this topic because this is a topic that most women are not even going to go to each other and talk about, right? And so we just grin and bear it, When the guy's having trouble with his testosterone, he's talking about it, obviously, because it's all over the news. So it's about time we talk about it too. And we don't have to be as boastful. Maybe we don't need a blue pill, but maybe a little something like a little estrogen, which I'm not prescribing to anyone. I'm just saying maybe something like a little topical estrogen or something like that can make a world of difference in your life. And just even understanding what's happening to you can make you feel a lot better about the changes, just to understand that this is something that's natural, that it's not something that's strange that's happening to you. Okay? So drop me a comment. Let me know what you think. Let me know if this was helpful. Let me know if you're planning on trying HRTs or not, or anything that you'd like to say. I just like to hear from you. That's it. I would just love to hear from you. Subscribe and hit that notification bell so you can be notified anytime I upload a new video. And until next time, you stay beautiful, empowered, and sexy. And I will see you in the next one. Thank you for joining me for You Can't Handle the Truth. See you next time.